Hello everyone, welcome back to my channel. If you can't tell, we're switching up with locations today. Winnipeg is finally nice again. It was really cold for a little while, so I decided why not enjoy the last few days of summer and film a video outside. So today's video is a very important one. September is Blood Cancer Awareness Month, and I'm all about awareness and making sure that everyone knows the signs and symptoms of blood cancers. The Lymphoma and Leukemia Society decided to start a campaign for the month of September called #KISSBLOODCANCERGOODBYE, and how I am kissing blood cancer goodbye is by raising awareness to help early detection. Recently on my Instagram and on one of my previous videos, I asked people to send me questions that they had about blood cancer, my cancer experience, cancer in general, and I actually received quite a lot of questions, so I'm going to divide them into two different videos. This one specifically is going to be only about blood cancers, and then I'll do another one in the future just about answering more of the questions that were more general or specific to my personal experience with cancer. Also, notice how I'm wearing red, specifically for blood cancer awareness. Question number one, and this is one that was asked frequently, was what is blood cancer? And that's a great question because I honestly didn't know what blood cancer was until I got blood cancer. Blood cancer is a cancer that affects the cells in your blood, bone marrow, and lymph nodes. So how this works is cancerous cells affect your red blood cells, your white blood cells, and your platelets. Some blood cancers can even form tumors, such as mine. So I had a tumor in my chest, or also known as the mediastinum. And there are three main types of blood cancers, so leukemia, lymphoma, and myeloma. Fun fact, there are actually more than 100 different types of blood cancers. Isn't that crazy? Question number two, what are the symptoms of blood cancer? Well, those honestly vary from person to person, but the most common ones are fatigue, shortness of breath, unintentional weight loss, an itch that just won't seem to go away no matter what, easy bruising, swelling, lumps or bumps, especially in the neck, under your armpits or groin area. And one of the most common kind of telltale symptoms, especially of lymphoma, is night sweats. My symptoms were actually very random and weird. So one of mine was extreme fatigue, but I associated that with the fact that I was in school full time. I worked 2 to 3 part-time jobs and just had a really crazy schedule overall. Another one of mine was a really bad cough. And again, I associated that with winter, with a lung infection, something minor. And the third one was swelling. So because my tumor was growing so fast, it was cutting off the blood circulation to the left side of my body, the left side of my arm, which is why my arm was swollen. So again, as you can see, these symptoms vary. They're very random, which is why it's important to know yourself and know your body. And if something is off, go see a doctor. Question number three, and this one actually came up often too, how does somebody get cancer? Well, if they knew what caused cancer for sure, I'm sure it would be much easier to find a cure for all cancers, but to be quite honest with you, nobody knows for sure what causes cancer. I have ideas of what I think caused my cancer, but there's no way for sure for me to ever know, and I probably honestly will never know. Some believed factors of why people get cancer are environment, meaning where you live, the quality of the air of where you live, the quality of just overall the environment that you live in, your lifestyle, your immune system. So I have a very weak immune system, which may be part of the reason why I got sick. Your health, obviously, just overall in general. Stress, I think stress is a huge part of potentially putting yourself at risk for cancer. Family history is also a big one, but like I said, there's no way of for sure knowing what causes cancer. Next question is, can anyone get cancer? And the answer to that is yeah, anyone can get cancer. Some people are more, I guess, at risk than others because obviously not everyone develops the disease, but I think everyone can possibly get the disease at one point in their lives. So I actually did some research on this topic because I wasn't quite too sure about the answer, but according to the Canadian Cancer Society, 1 in 2 Canadians will develop cancer at some point in their lifetime, and 1 in 4 will unfortunately die from the disease, which is pretty scary that half of the country that I live in will develop cancer at some point in their lifetime. Question number 5 is, does blood work show blood cancer? In some cases it can, depending on what kind of blood cancer it is. However, blood work is usually the first test that doctors do because blood work shows indications that something is wrong. High white blood cell count, meaning your body is fighting off an infection. So if your white blood cells are high or your red blood cells are high or low, that's often a red flag that is associated with something is wrong in your body. And there are a variety of different kinds of blood tests. Next question is, what types of tests confirm cancer? Again, this really depends on the type of cancer, but the most common tests for cancer detection are blood work, x-rays, CT scans, MRIs, PET scans, so that's the one that shows the cancer cells, but that's usually when they find out that there is a cancer. Biopsies and bone marrow biopsies. Next question is blood cancer more curable than other cancers? Yes and no. Yes, because blood cancer is actually a very common cancer. The cure rate and survival rate for blood cancers is pretty high. However, the reason I said no is because there are so many different types of blood cancers that there may not often be a very evident treatment plan. So just for myself, the cancer that I had is actually quite rare, and there is no data and information to back up what the proper treatment is, what the survival rate is, and stuff like that. So even though I did have lymphoma, which is a very common blood cancer, primary mediastinal large B-cell lymphoma, which is the specific type of blood cancer that I had, is very rare and not a lot is known about it. So I was a little bit of a guinea pig for my hospital to kind of figure out how to treat it, what to do with it, and how to cure it. Number 8 is, has anyone in your family had blood cancer? Cancer runs in the women on my mom's side of the family. Unfortunately, every woman up to myself that is on my mother's side of the family has had some form of cancer in their lifetime. Blood cancer though, I do believe my great aunt had leukemia, but I could be wrong about that. I'm not quite too sure. The cancers that run in my family are just like from a wide variety and so many different kinds of cancers that is pretty crazy. And like, although lymphoma is known to not be like a genetically transmitted cancer, like who really knows? And the last question, which was actually a very interesting question and one that I've gotten quite often. Are you allowed to donate blood after having blood cancer? To get the answer to that, I decided to call Canadian Blood Services and speak to a nurse and kind of tell her about my situation. And the answer is no. As of right now, even though I'm in the clear, the nurse said that they really don't have any good technology and any way to kind of prove that since I did have a blood cancer, it is safe for me to donate my blood. So as of right now, if you have had a blood cancer, you are not able to donate blood. Well, I mean, at least in Canada, I'm not sure how it works in other countries, but in Canada, I'm not allowed to donate blood. And I think that's probably for the rest of my life. Alrighty, and that wraps up today's video. Didn't get attacked by any geese, thankfully. Had a few people staring at me, giving me weird looks, but everyone's curious, right? So thank you so much for tuning in. As I said, I will be doing another Q&A more about my personal cancer journey and just more general cancer questions in a little bit, but since it is September, which is Blood Cancer Awareness Month, I really did want to get this video out. If you would like to know more about blood cancers, the signs and symptoms, and different information about that, you can visit the Lymphoma and Leukemia Society at their website or on Instagram. They have a pretty bumpin' Instagram, I'd say. And if you are a blood cancer survivor, thriver, or have been affected by blood cancer in any way, post a picture of yourself on how you will hashtag KISSBLOODCANCERGOODBYE. By the way, this is my first time out in public without anything on my head. Like, I've gone out in public without my wig before, but I've always had a hat on, and this is kind of my first time without a hat. I kind of like it. But anyways, thank you so much everyone for watching. If you have any more questions about blood cancers, please leave them down in the comments below. I hope I answered some questions pretty decently and taught you a few things, but that's the end of this video. So for now, know yourself, know your body, know the signs and symptoms. If something is wrong, go to your doctor. And until next time.